Diabetes, a silent predator, a global pandemic that's not infectious but affects an astounding 422 million people worldwide. It's not just a disease, it's an international health emergency. Diabetes is a chronic condition that disrupts the body's ability to process sugar. To understand this, we need to dive into the human body's fuel system. When we consume food, our body breaks it down into a simple sugar called glucose. This glucose is our primary source of energy, and it's carried through our bloodstream to reach every cell in our body. However, for glucose to enter our cells, it needs a key. This key is a hormone produced by our pancreas called insulin. In a healthy body, the pancreas releases the right amount of insulin to match the amount of glucose in our blood. Insulin binds with glucose and escorts it into our cells, which use it for energy. But what happens when this process goes awry? Well, that's where diabetes comes in. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes, often diagnosed in childhood, is an autoimmune condition where the body mistakenly attacks the insulin-producing cells in the pancreas. Consequently, the body produces little to no insulin, leaving glucose stranded in the bloodstream. Then there's type 2 diabetes, the most common form, often diagnosed in adults but increasingly found in younger people. In this condition, the body either doesn't produce enough insulin or the cells become resistant to insulin. The result? Again, glucose remains in the bloodstream. Lastly, there's gestational diabetes, which occurs in some women during pregnancy due to hormonal changes that make their cells less responsive to insulin. Regardless of the type, the end result is the same: high levels of glucose in the blood. But why should we worry about high blood sugar? When blood sugar levels remain consistently high, they can damage blood vessels and nerves, leading to complications like heart disease, stroke, kidney disease, vision problems, and nerve damage. Now, you might wonder, what causes diabetes? It's a mix of genetic and lifestyle factors. While you can't change your genes, you can certainly influence your lifestyle. Unhealthy eating habits, lack of physical activity, and obesity are significant risk factors for type 2 diabetes. Recognizing the symptoms of diabetes is crucial for early diagnosis and management. These may include frequent urination, excessive thirst, unexplained weight loss, constant hunger, blurry vision, and fatigue. If you experience any of these symptoms, consult a healthcare professional who can diagnose diabetes through blood tests. But there's hope. Diabetes can be managed, and type 2 diabetes can often be prevented. Regular physical activity, a balanced diet, maintaining a healthy weight, regular checkups, and if needed, medication can all play a part in managing this condition. Remember, diabetes doesn't discriminate. It can affect anyone. Every individual story is a testament to the fact that diabetes can be managed and life can be lived fully. Knowledge is power, and sharing this power can make a world of difference. By sharing this video, you help spread awareness about diabetes, its prevention, and management. Together, we can turn the tide against this global health crisis.